Hi, my name is Phil McKee. I've been doing massage therapy since about 1985, and a couple of years later I discovered Chinese methods of Tui Na and Qigong Tui Na, which is the energy aspects. Well, one of the nice things about being in the same profession for 20 or more years is that you actually learn a few things. I'm always looking for things that work and that are simple and easy to execute and understand. So today I want to tell you a couple things about how to take care of your neck and shoulders. Most of us at some point in our lives have had some kind of problems with the neck and shoulders, and it's mostly due to stress in general. So the effects on the body of stress of any kind, physical or non-physical, are threefold. We can speak of energy rising, coming up, lifting your shoulders, and going forward because you have to get things done, and then contracting. And these three effects together make you very unhappy, particularly your neck and shoulders. Now, of course, what you want to practice doing is dropping the shoulders, elongating the neck, and sitting back and being more relaxed. But let's say you got a pain in your neck. Let's say it's on the right side and it doesn't seem to be going away. Well, let me show you one thing that works pretty well. What we want to do, there are two muscle groups here. A real thin one called the levator scapula, and then a larger group called the trapezius. And you don't need to know which one is in trouble in order to make it better. So what we want to do is contract these muscle groups passively without using the muscles, but using gravity and levers, shall we say. So what I can do, my arm's long enough, I can just put my fist on the seat beside me and straighten the elbow, lock the elbow. And by the way, it's the only time you'll ever hear me say lock the elbow. We have this phrase in Tai Chi, a locked joint is a broken joint. Shuts down the energy flow and not very good for it. But there are exceptions, and this is one of them. So this lifts my shoulders. And then what I want to do is turn my head and drop that corner of the skull onto that corner of the shoulder blade. And I'll probably need to turn it a little bit and finesse it. And my point, oddly enough, is to find the area of most pain and focus things there. And when I get there, I just wait. And I wait for as long as the textbooks say 90 seconds. But it may be sooner. And wait until it begins to relax and release and let go. And you can usually feel it if you're paying attention. It's probably not going to go all at once, but my experience takes about 30 seconds to start relaxing and another 30 seconds to go on average. But if it's going to work, it'll work within a minute or two. Now, if you find this uncomfortable, you could find another way to do it, like use the armchair. Put your elbow on the chair arm and kind of slouch into it and do it like this. And there would be other ways if you wanted to be creative with it. If I'm doing a massage session, I'll just pull the elbow up and bend the head down toward the shoulder and hold it that way. So that's the first one. That's the practice. Now, why does it work? And by the way, we call it, there are three different names. We call it positional release, because you put the muscle in a certain position. It's also called counter strain, and it's also called spindle cell. And that is probably the most descriptive term for why it works. There are teeny little cells inside the muscle tissue that look like spindles, and spindles on a loom that hold thread. And when the ends of these cells are brought together, they have the effect of just letting go and releasing. So that's why we think it works. So that's the first one, spindle cell release, positional release, counter strain. The second one, I never quite known what to call it. So I just call it sliding. And I learned this at a Tui Na workshop, but from a physical therapist. So I'm not sure if it comes from the East or the West or both, because I showed it to the instructor. Oh, yes, we know that. So it may have been independently discovered both in the East and in the West. So here's how it works. Let's say again, left side of my neck. I can either take my right hand crossing over or my left hand, whichever seems to be more comfortable. And all I do is lay it on the skin. And just the weight of my hand is sufficient pressure. Next, I start moving the skin and see which way is it most likely to go. So I usually move back first and see, is that where it wants to go? And then I'll come forward. Is that where it wants to go? And you may need to go back and forth a few times to figure this out. It could be neutral. Then you would also try moving up toward the head and down toward the body and see which of those two directions it wants to go. Those are 4 directions total. It might be one of the diagonals. So you could divide into 8 and see where is the easiest direction for you to slide with just a few ounces of pressure. And then you wait. And you wait until something happens. What does something happen mean? Well, ideally, it means there's a relaxation. There's something releasing. There's something letting go. And already something is happening here. I'm just going backwards. You might be able to see that. And often I will stay with it for a few minutes or several minutes maybe, because things will continue to happen, and what could easily happen is the directional shift. I'm going back, and then suddenly maybe it wants to drop down. So I follow. You just follow it wherever it wants to go. And you can keep it up for a few minutes. And the nice thing is, after a few minutes, things will happen more distally, meaning far away, like over to the other shoulder. That might drop. There it goes. Just because I pushed in that direction. It might go down the body, but that's not necessarily because I pushed in that direction. The body could relax down the back because I pulled up or to the side. You don't know. You just check and keep checking. And that's probably the hardest thing about this particular technique. It doesn't require much of a physical effort, but it requires paying attention and listening. Even though listening isn't the right word, we use it, but it really means feeling. So tuning in and feeling where do things want to shift, and that's the direction you go. Sometimes we call this an indirect treatment versus a direct. Direct would mean you take it in the direction it doesn't want to go. I'm not suggesting that here. I'm suggesting the go where it wants to go, follow, slide wherever it wants to slide, stick with it, and see what results you get. For those of you who may know this already, I'll tell you one more level you can take it to, literally. So the levels of flesh between skin and bone are considered significant in Chinese medicine. In fact, they separate 5 layers down to the bone. The bone matrix is considered layer number 5. That means you got 4 layers before you get there. So you can go deeper into those layers, and they may want to go in their own direction. And you can get there. The more crude way is to press deeper. The more sophisticated way is to let your intention sink and your mind sink into the body, and then move without really changing the pressure. So that's a little more advanced if you want to try that. That's the practice. What is the theory behind it? Well, if you just go in skin deep, right under the skin, there's a little layer of white material called fascia. And if you've been in the kitchen preparing chicken, you'll know what this is. You take the skin off, then there's a whole little white sheet. We think that this is the physical layer that holds the energetic layer, which in turn governs the whole physical body. So, Wei Qi, if you will, if you want to use the term from China. So by moving this border that holds the energetic layer, you in turn influence the larger physical structure, in this case muscles, which causes them to relax and to let go. If you talk to an acupuncturist, that's the depth at which they place a needle. And they will talk in terms of lines and points, but it's a little bigger than that. Now we're talking in terms of a sheet of energy that controls the physical body and helps it to either hold on or let go. So those are the two things. Again, the positional release, you find a way to contract a muscle passively, hold it for 90 seconds at the point of its most pain, most tension, and let it unravel. Or two, the sliding technique. You just move the skin where it wants to go and follow it until it comes to a point of stability. That takes off the first layer. I'll often do this on my clients. I'll just go neck, upper back, middle back, lower back. I'll do it a little more quickly, 15-30 seconds each, so only a minute or two on the whole back. But it takes off the first layer, and then I can go in a little deeper without being interrupted. So play with these. You won't get them necessarily the first time, even if you do have a natural talent. It does require some finesse. It does require some experience. And as you get more and more in tune, you'll get better and better at it. And if you're treating yourself, if you're treating someone else, you'll just get more efficient at it the more time you put into it. If you have questions, just write to me. I want this kind of material to get out there. I want people to function better. And so by all means write, and I'll definitely write back. And good luck with it, and thanks for listening.